In the event that someone has to go to the hospital after a fall or pneumonia or dehydration, something like that, if they are there for 3 consecutive midnights and they have a qualifying diagnosis, then chances are high that they'll be approved to go to a skilled nursing rehab. So the rehab that you go to after that, the social worker, case manager might come in and say, hey, we're going to discharge you in a couple days to XYZ rehab. You have the right to pick your rehab. As long as there's availability and they'll accept you, you can look up some other ones. So you should check out CMS and Medicare.gov, Nursing Home Compare, so that you can figure out the star ratings of the rehabs and look at their quality measures and see which one might be good for you to go to. But a lot of times people have issues when they're in the hospital and they're not admitted right away. Sometimes first they're in observation status, and maybe they're in observation status for one day, one midnight, and then the next 2 they're on admitted status. And unfortunately, that means that they're not going to be eligible to go to a short-term rehab. So when you first get to the hospital, if you think you might be there for over a day or 2, make sure that you ask what status you're in, if you're admitted or if you're in observation status. And if you're there for 3 consecutive midnights and you have a qualifying diagnosis, you can look and see which nursing home or which skilled rehab you can go to from there to get physical therapy, occupational therapy, speech, and then get home.